If you're new to Ozone, or even if you've been utilizing Ozone for a while, if you're a practitioner, one of the major questions is, how do I use it? Where do I use it? How do I choose, to do ear insufflation or, rectal or even vaginal? Again, it really depends on you as an individual. Where are your symptoms coming from? If you're dealing with, lungs, a nasal sinus, you could actually do BOO, which is where you're bubbling the ozonides with the oil. You're actually getting that into your system. If you have an ear infection, you're probably going to do the actual ear insufflation. Systemically with IV, you're typically going to be with, and I highly recommend being with a practitioner to do that, and then again rectal or vaginal or other forms of modalities. So again, try to get to the specific area that the condition is at, but how does it affect you on a systemic level or a not systemic or localized? When we look at this kind of spectrum of ozone therapy, the most systemic effect that you're going to get and the most robust effect is going to be through IV ozone therapy. A very close second, or pretty much right there with it, is going to be rectal insufflation, and then possibly vaginal right next to that. And so that's going to give you the most systemic. It's going to have a localized but also a very systemic effect. On the other far side of that is more going to be like bubbled ozonated water. Which is not going to have a massive systemic effect. Even like subcutaneous or joint injections, I work with clinics that are, doing knee injections, shoulder injections, joint injections. That's going to give a local effect, but it will also have what I would say is a minor actual systemic effect, because when you inject and say to an elbow and to a shoulder, the majority of that, and again we know that ozone is very reactive, so it's almost instantaneous that it has that reaction within say the shoulder joint, so it's going to have the major effect there, but you're also going to feel it coming out. I actually let practitioners know and patients know that like when you drink a cold glass of water, you can feel that going down. If you're getting an injection, sometimes you can actually feel that ozone technically traveling to the areas of oxidative stress, so that muscle tension, that tightness. And that also lets us know that it's going to have some sort of a systemic effect, not just localized, which is also really cool because we know it's actually binding to those oxidants and helping to restore some of that damage. Again, on that spectrum, you have your IV ozone, which is most systemic, and probably something like the ozonated water, which is going to be more localized, even ear insufflation, probably more localized. That's kind of the spectrum of trying to determine what therapy and what application you want to be able to use. And so if you're trying to figure out exactly kind of where to get started, you are new to ozone, and we've discussed other forms and therapies. What I typically recommend to get started kind of is almost like a home clinic where you can actually hit almost every single area of your body, both on a systemic effect, but also localized, is starting with something like an ear insufflation, a water bubbler, so that obviously you can drink and utilize that, and then the rectal insufflation kits, because the rectal insufflation kits are going to give you the most robust systemic effect when you're at home. So you're kind of hitting every single area that you would need if you're just getting started.